Hello, and welcome to our webinar here at Navigating Education. We're so glad that you could join us. My name is Dr. Melissa Durtschi. I'm the director here at Navigating Education. And our mission here at Navigating Education is to empower families and students with knowledge so that they can be empowered to choose their own educational pathways. And we accomplish this in two major ways. So the first way is that we conduct educational evaluations here for learning disabilities. And then we also do consultative services for things like school meetings, 504 IEP meetings, or consultative services one-on-one with families. Today, I'm here with Liz Henderson. She's one of our academic clinicians here at Navigating Education. Thank you so much for joining us, Liz. We're going to turn the time over to you in just a minute. She's going to be talking to us today about dyslexia and some commonly asked facts and some myths about dyslexia. A couple of housekeeping items. Please make sure that if you have questions and things, this is a pre-recorded video, but we'd like to answer your questions. So you're welcome to put it into the YouTube. Also, our email address is on there, so you're welcome to reach out to us directly. Any handouts, there will be a handout for more additional information that will be linked below in the description of our YouTube channel. And you can also join us on any of our social media accounts for further discussion. We're on Facebook, YouTube, Instagram, and that's where we're at right now. And Liz, like I said, I'm so excited that you're here with us today. And we're going to turn the time over to you to introduce yourself, give us a little bit of background of who you are, and we'll go into your presentation.
Great. Thank you, Melissa. I'm super excited to be here today and to just discuss a topic that I am passionate about. I've spent most of my career working in. So I am going to just share a little bit about myself and what brought me here to Navigating Education and this webinar. If I can, sorry. Here we go. All right. Okay. So my name again is Liz Henderson, and I have been working in the field of special education for over 20 years. I have spent about 15 of those years as a special education teacher in Colorado. My licensure, I am a mild moderate special education teacher. I have my master's degree in special education, and I had the opportunity kind of early in my career to get some specialized training in the Wilson reading system, which started to educate me about dyslexia and multisensory language instruction. I'm sharing here a picture. I am also a mom of two teenage girls. My daughter in the middle there, Rachel, does have a diagnosis of dyslexia, but she is also twice exceptional. So she is gifted in language skills, and we can we'll talk about that is sometimes fairly common in individuals with dyslexia. So after working in public schools, I spent the next 6 years working for Children's Hospital, Colorado, doing learning evaluations and reading therapy for with young children through teens. who have a diagnosis of dyslexia. But part of my job was doing the evaluations, and the, I guess, most common question that would come to me from parents is, okay, my child was just diagnosed with dyslexia. Now, what do I do? I've given them all sorts of testing information. And what I, over the course of time, kind of started explaining things to them in 3 parts. First thing that I recommend to parents, if their child has a diagnosis of dyslexia or suspected, is to educate yourself. Dyslexia, there's a lot of information out in the community, out on the internet. Some is accurate, some is inaccurate. So that needs to kind of be mission and goal number 1. The second recommendation that I make is to find and get started with some intervention for your child. Typically that involves something extra than what's going on in the classroom. Obviously, if a child is lagging behind, they're going to need to have some different type of instruction. That might happen in the school environment, that might happen outside, privately. So I'm going to talk about that. And then additionally, it's really important to access supports both for the parents and for the child that are just beyond the intervention, that will make learning and developing literacy skills more successful. Okay. So when I say educate yourself, what am I talking about? I'm talking about understanding the actual definition of what is dyslexia. There is a formal diagnosis that I'm going to kind of break apart for you. What are signs and symptoms? Sometimes parents may suspect that their child has dyslexia. Sometimes they may hear something from the classroom teacher. So we're going to talk about what that looks like at different times in development. Also, what's something that I'm kind of passionate about is that there's a lot of myths and misinformation out there about dyslexia. And I just want to kind of alert families to that. And then what are common coexisting conditions? Sometimes parents come in, they're concerned that their child has dyslexia because their reading isn't progressing, but there may be other commonly occurring challenges that they're experiencing that are getting in the way of learning. So it may be dyslexia, it may not be. So pulling that apart. So I'm going to just move excuse me. Okay. Okay. Okay, here is our formal definition of dyslexia. Okay, and there's just some key components that I highlighted here. Dyslexia is a specific learning disability that is neurobiological in origin, meaning that it is hereditary. So you often see these reading difficulties run in families. There may be a grandparent or a parent or a cousin that also struggles significantly with reading. Additionally, neurobiological tells us that it's not just poor reading instruction. There may be excellent reading programs in the school, but for whatever reason, your child is not making progress. So there's something biologically going on that is impacting reading development. It is characterized by difficulties with accurate or fluent word recognition. Kids struggle sounding out words, recognizing words, and that's seen not just in reading, but also in writing. It's also important to know or to emphasize that dyslexia is a language-based disability. Commonly, people think that it is a visual problem because there's reversals, switching words around, but it really is a deficit, or starts with a deficit in the phonological component of language. So being able to recognize sounds and syllables and manipulate them. Another component of the definition is that it's unexpected in relation to other cognitive abilities. So oftentimes kiddos are doing really well in school. They're bright, they do well in math, they understand and comprehend information. But when it comes to reading and spelling, there is a noticeable lag. Unfortunately, secondary consequences that often develop from dyslexia is that there are problems in reading comprehension. Kids are working so hard at decoding words that they're not able to give the attention that they need to vocabulary or some higher level comprehension skills. Also, there is reduced reading experience, meaning if reading is difficult, kids are going to avoid it, and just over the course of time, they are not going to be as exposed to the same amount of vocabulary and language that appear without dyslexia might be. Okay, signs and symptoms. Preschool signs and symptoms may vary from when a teen is older. So it's important to kind of keep that in mind. Things that you see in a preschooler might be mispronouncing words. The example I give here is saying Betty Tear instead of teddy bear. Struggling to name familiar objects. Often, instead of being able to come up with the vocabulary word, they like to use thing and stuff. Kiddos having difficulty learning nursery rhymes, having trouble remembering sequences, like singing the letters of the alphabet. In conjunction with that, I've seen kids who only know their alphabet if they sing the song. They're not able to name and sequence the letters unless they start at the beginning and unless they sing the song. So they're really learning the song, not necessarily the sequence of letters. These are also kiddos that are telling stories that when they're sharing information, it's kind of hard to follow them. That sequencing piece is difficult, and having trouble talking about things just in logical order. Grades in kindergarten through 2, when they're have spent more time in school, these are the kiddos that have trouble learning letter names and remembering the sounds that go with the corresponding letters, confusing letters that not just look similar like B and D, P and Q, but also confusing words, letters and sounds that sound similar. That can often be seen when they're starting to spell. Struggling to read familiar words, especially if there aren't any pictures. You start to see substitution of words where they're using context. The example I have here is saying house when the story says home. They see that initial letter, they use context and are guessing, but not actually reading the words that are there. They may have trouble segmenting words into individual sounds or blending sounds together and learning how to decode. Also, just difficulty remembering how words are spelled, and learning spelling rules. In grades 3 through 5, there are also, you start to see substitutions or confusions in small words like for, of, because letters and sounds aren't really well established. These kids are going to have difficulty sounding out new words, especially when they're multi-syllable. They don't know how to break the words apart. Also, the amount of time that it takes them to decode words is just going to slow their reading down. They're not going to have that automatic recognition of common words. Because they're working so hard on decoding, oftentimes their ability to retell a story or recall key details is compromised because all their thinking and focus is going on the decoding process versus the comprehension. You'll still see some letter reversals, poor spelling. And again, these kiddos are avoiding reading and get frustrated and upset easily, especially when they have lengthy assignments. For teens and even going into adulthood, these are slow readers, leaving out words, substituting words. They definitely have an easier time answering questions if they're able to listen to text. They also struggle to remember common abbreviations. Another common or frequently seen difficulty is actually in the area of math. Individuals, if they're having difficulty similarly remembering letters and sounds, they often struggle with math facts. Again, that's the small pieces of information. So that's something that is co-occurring that we see, and we'll touch on a little bit later on. Dyslexia myth.
Liz, before we
Yeah,
go into the myths, I had a follow-up question around the grade levels. Thank
sure.
you so much for sharing those grade level bands. And a lot of times we have families asking about, when should I become concerned? So can you touch just on that, about these grade level bands, and if they, when should they be concerned? Is it when they go into the next band? And a lot of times what I talk with families about is trusting your parent gut, about if you feel like something isn't quite right, talking to your child's teacher first, getting norm referenced or quantitative data on, compared to other kids their age, how are they doing comparatively? What other suggestions do you have for families on when should I become concerned?
I think that the parent gut piece that you mentioned is probably the first and most crucial component. What I would also say is that in the school environment, in preschool, in kindergarten, schools are assessing children multiple times during the school year to see if they're making the appropriate gains. If these kiddos aren't making the gains, they're those needs are identified and interventions should be put in place, starting, I believe, as early as kindergarten through second grade. Schools have what's called a read plan. So if there are any red flags on the assessments, schools need to be identifying that, writing a goal, saying what the need is and what type of intervention that they're going to put in place. And so my recommendation is kind of, if there are any red flags, you want to see that the child is making progress with the intervention that the school is putting in place. The other piece that I like to share is the younger children are, and the earlier you can get intervention in place and supports for lagging skills, and it may not be dyslexia, but it may be lagging skills, the better it is for the child. So sometimes I think schools are hesitant and they'll try multiple interventions. And I would say, if you're in a position where you could get additional support for your child, in addition to what the school is doing, that would be great. The earlier the intervention occurs, the better it is for the child. So I think that's kind of when the gut can indicate, let's take action. I would give the school a chance and see what their intervention is and see what type of progress the child is making. But the younger the child is, the better. So
Yep. Thank you so much for sharing that.
yeah. Okay, I'm going to just move on to common dyslexia myths. Dyslexia is not intelligence-based. I have come across teachers and doctors and numerous professionals that say, oh, this child can't have dyslexia. They are too smart. They understand everything that I'm talking about in the classroom. So dyslexia does not correlate to a low IQ. If you remember when I was going over the definition, it typically occurs with an individual that cognitively really has many other strengths. And those individuals are also often good at compensating with those strengths. So that's, again, if there is kind of that unexpected difficulty, some of those signs and symptoms that we saw, it would be worth having a screening done, having an evaluation done, just because sometimes children do compensate. I touched on this next point also. It is not a visual problem. It's not seeing words reversed or letters backwards. It's actually part of it's a language-based disability. It is not due to laziness. If the child just spent more time reading or tried harder, read more books, that these skills would develop. That is not. It is also not, dyslexia is not a disorder that you grow out of. Individuals with dyslexia can learn how to read, however, they will always have some level of challenge. They may be slower readers. Things may click, and they may be able to use different accommodations and tools. They may be able to compensate, but that disability is not something that they grow out of. Another myth is dyslexia doesn't show up until elementary school. I think that has to do in part with how schools are assessing, and the norms developmentally for children acquiring reading skills are much broader when children are in preschool and kindergarten. So that norm, however, there are flags kind of that I touched on before that need to be paid attention to. So what's developmentally appropriate kind of tightens up more when kids are in elementary school, but the signs and symptoms are definitely there when kids are younger. And again, the sooner any kind of intervention happens, the better it is for the child. Lastly, dyslexia only happens in the English language, and that is not accurate either. There are studies and research of it happening all over the world. Coexisting conditions. These are other specific learning disabilities. So by coexisting, I mean that an individual with dyslexia may have a math disability, dyscalculia, or dysgraphia. They may also have speech and language impairment. Often when children are younger, this is how they are first identified with expressive or receptive language issues. And again, dyslexia is a language-based disability. So having these other language issues co-occurring is somewhat common. The social emotional component, struggling with any kind of disability definitely takes its toll and can impact social emotional development. Also, there is a estimated 30% occurrence of dyslexics that also have ADHD. Intervention. Research has shown that the best type of intervention for individuals with dyslexia and really literacy, language, and reading development is something called multisensory structured literacy. There's the best evidence for this. It is a structured approach where language skills are specifically taught using a multisensory method, and the results in student progress are monitored, and these programs are diagnostic and data-driven. Common programs that are used in the schools and privately are Orton Gillingham International, Wilson Reading, Take Flight, Linda Mood Bell, Barton. Some of the school districts do use these curriculums. It is really important that if you are pursuing intervention for your child, that this type of reading curriculum is used and that you have a professional that is trained in one of these programs, again, because that is what research has shown to be the most effective. Who can provide this? Again, just explaining a little bit more. You want to have someone that is certified that can provide you with references, that is doing continuing education in this field. Navigating education, we do have a referral list. Another place to find qualified instructors would be the International Dyslexia Association. They have a website, particularly the Rocky Mountain branch. They have a list of qualified instructors for the multisensory structured. In terms of school interventions, I had touched on a read plan. If your child is not making effective progress, that is when you might consider pursuing a learning evaluation or an IEP. Oftentimes the multisensory programs are provided to children on IEPs in their intervention services. How long will my child need this type of intervention? It depends on the individual. Intervention needs to be consistent and intensive. And it typically, I would say in my experience, needs to go on for roughly 1 to 2 years. You want the goal for the child to be functioning independently in school with the use of accommodations and other tools like assistive technology. But it may take a year or two.
Before we go on,
Yeah.
I just wanted to give, can you go back to the section that you were just in?
Yeah.
Perfect, even right there. Yep, right
Yeah.
there is great. So wanted to give a personal example of my own child going through tutoring services. And typically, like Liz, you had said, it can take 2 to 3 years. Sometimes a student will also have a processing speed where acquiring knowledge takes a little bit longer. That happened to be with my daughter. And so for her, she was in tutoring twice a week for 5 years is how long it took her to get through her program. And it built the confidence. I think looking back, hindsight, looking back on experiences and such, that was such a valuable experience because could I have taught her the skills necessary? Sure. But there's this component of I was mom. I was mom to her. And as we all know, parent, it's different. It's a different dynamic when you're parent and child versus teacher and child. And so for her, this was a separate setting meant specifically for her. She went to a different place, location, and worked with her tutor and built a great relationship with her. I would say that is really important as well, is that relationship between the teacher and child. If it's not a good fit, but you're in a good program, you can always look for options on making sure that the relationship is a good fit. The other thing that I wrote down was a concern that had come up for me as a parent, and then also talking with families, is my child goes to school all day long and then has this hour twice a week. Isn't that too overwhelming for them? And so I wanted to just mention about that an accommodation can be written in if your child has a 504 or an IEP plan on the days that they have that testing, I'm sorry, not testing, the tutoring, on those days, it can, you can work with the school to make it so that that's their homework. And that way they're not doing it in addition to, unless it was something like you need to read these certain chapters and be prepared for discussion in class. And that can be given ahead of time so that the child can work on it over the weekend before, so that they can be prepared for the next day in class. But that can be written into the plan. And I just wanted to mention that because I get that, like your child's burned out by the time they get home.
Yes, and I'm glad that you mentioned that. Also, because this type of intervention is important, but it's also very important that your child, if they have extracurricular activities that they enjoy or that they're good at, that there is some balance, because if all their time and energy is spent on what's difficult, those are the things that impact social emotional skills. So having that balance and that, I want to say well-rounded exposure to things, because these children are also very good at other things, and they need to remember that that is an equal a part of who they are and what they're doing. And again, to me, it goes back to the earlier you intervene, the better the payoff is going to be, because if you have to take a middle schooler and have them have tutoring 2 days a week after school. And that it's just going to be more taxing than if you address it early on. If they need to leave school to go to tutoring when they're in elementary school, there's more flexibility. I just feel like the payoffs, the earlier the intervention happens,
Yeah.
payoffs.
And I think it circles back to that following your parent gut, right?
Yep.
If every year you feel like you're saying, there's something, sometimes the child might be masking. And at some point they stop masking and all of a sudden it's like, so follow that parent gut and get some quantitative data around how is my student doing comparatively? Are they on the right track, or are they masking some of those things?
Yeah. Or compensating. So. Okay. Other supports. This is a crucial piece of the journey with dyslexia that can support the child and the family. Number one on the list is usually audiobooks. Kids can keep up with what their peers are reading or where they are. Often comprehension is not lagging. They can listen and comprehend books that their peers are reading or where their interest levels are, that they can access. There's lots of apps and websites, understanding.org, and there's going to be a list of some websites, again, part of that educating yourself. Tools, the assistive technology, speech to text is a big one that can be used. Community, there are parent groups out there, student groups. There is some information out there that I've read that 1 in 5 children have dyslexia. Dyslexia occurs on a spectrum, so it may be mild or it may be severe. But if you think of a classroom of 20 kids, 4 children in that classroom, according to statistics, may have dyslexia. So having that community to help navigate who are good tutors that are out there, what are apps that can help with spelling and grammar. Going to conferences is another great way to just kind of keep up to date on what's available, what's the latest information. Webinars and podcasts, if you enjoy that kind of thing, is a great way to educate yourself. Assistive technology, I touched on a little bit. Some of that can be provided to teachers. I know even just having kind of microphone systems in the classrooms can be helpful for students and teachers. Accommodations, I'm thinking off the top of my head of one called Grammarly that can just facilitate the writing process. So familiarizing yourself with some of the supports that are out there will make the journey for you and your child better. Here, this is just a breakdown of a breakdown of some of the resources that we will have available for you. And Melissa, maybe you can tell me where that's going to be posted.
Absolutely. Can you show the other couple of, I think you have a couple other slides showing some resources, right?
Yes.
Just so in case somebody wants to take a picture.
Yep. That's great.
Awesome. And where you can access this list is when Liz stops share, I'm going to share my screen so that you can see what it looks like in the downloaded form. Her presentation will also be available below in the description on the YouTube channel. It'll be there. And then Liz, if you can stop share, I'm going to go ahead and share my screen to show them what the other download will look like.
Got it. There we go.
Awesome. So when you download, it will look like this document right here, and it's going to have the things that Liz just shared for her list of items, and this will get you kind of going into, hey, where on earth do I look? Where are some reputable sources to look for expanding my knowledge about dyslexia? You can also join us on any of our social media places. It's going to be at Navigating EDU for education, at Navigating EDU. And you can join us there for continuous, we share lots of articles, videos, live events, things like that to talk about dyslexia is definitely one of the ones that we discuss. One of the things that I wanted to mention, you mentioned the conferences. IDA, or International Dyslexic Association, here in Colorado, it's the Rocky Mountain branch, and it's right here. They hold 2 conferences every year specifically dedicated to dyslexia. They are phenomenal and well worth your time and investment. And you can look for, there's the national one, and then also I'm sure in many of the states, when you have the different branches, you can look in your state and check into what information, what type of conferences they have specific to dyslexia. So thank you so much, Liz, for joining us today and sharing your wondrous knowledge about dyslexia.
Melissa, one more thing.
Yes,
could we
absolutely.
add my name and email? So if anybody would like to reach out to me, I would be happy to email or have a phone conversation to explore things a little bit more. I'd be happy to do that if anyone is interested.
Thank you so much, Liz, for offering that. That's amazing. All right, make sure that to our guests, thank you so much for joining us today, and make sure to subscribe to our YouTube channel, and we'll be doing follow-ups with Liz on more in-depth on different parts that she has talked about today, and kind of diving deeper into what does this mean for your child. Thanks so much for joining us. Thank you.
Hi, thank you.